Acute infectious diarrhea. Acute diarrheal disease, also known as gastroenteritis, is a disease characterized by acute onset, usually defined as a duration of less than 14 days, of diarrhea. Diarrhea is defined as the passage of unusually loose or watery stools occurring at least 3 times a day, or more frequently than is normal for the individual. Acute diarrheal disease can be acquired through ingestion of food or water or through contact with someone carrying the pathogen. The pathogen may be viral or bacterial and rarely protozoal or fungal pathogen. Establishment of an enteric infection depends on several factors. 1. The inoculum. 2. The virulence of organism. 3. The status of host defenses. The leading risk factors for acute diarrheal diseases is 1. Acute malnutrition. 2. Living or traveling to areas with limited access to safe drinking water and adequate stations. Most likely pathogens. Most cases of community-acquired acute warts diarrheal diseases have a viral origin. However, bacteria and parasites can also be causes. In acute diarrhea, the main symptom is new onset of 3 or more unformed stools a day, with or without fever, nausea, vomiting, bloating, abdominal pain, and cramping. 5 common clinical presentations can help identify cases that require specific treatment and management. 1. Patients with watery diarrhea. In these patients, the most likely cause is viral, mostly rotavirus and norovirus. 2. Patients with bloody diarrhea. Dysentery or invasive diarrhea with damage to the intestinal mucosa. These cases may benefit from antibiotic treatment. 3. Patients with persistent diarrhea. Symptoms lasting more than 14 days. In these patients, a parasite is often implicated, and the main risks are malnutrition and dehydration. 4. Diarrhea with severe malnutrition. In these patients, malnutrition is both a cause and consequence of diarrhea. 5. Diarrhea with recent antibiotic exposure. This condition is mostly hospital-acquired. Rehydration and electrolyte replacement is the main treatment for acute infectious diarrhea. Fluid losses can be compensated by drinking adequate fluids. However, in patients with significant acute bloody diarrhea and in severely immunocompromised patients, antibiotics may be given. The first line is ciprofloxacin. The second line is azithromycin or cefixime or sulfamethoxazole plus trimethoprim. Parenteral option is ceftriaxone. To prevent yourself from acute diarrheal diseases, you should drink pure water, use of improved sanitation, wash your hands with soap frequently. You should also have a good personal and food hygiene, and you should educate yourself about how infections spread. Vaccination against cholera should always be accompanied with other prevention and control strategies. Vaccination against measles could also substantially reduce the incidence and severity of diarrheal diseases.